They looked at different women who either had no contact with farm animals, had contact with, I think it was 1 to 2 or 2 to 4 or 4 to 6. And for every additional grouping of animals that mothers had contact with, they found a corresponding decrease in the level of inflammatory and immune-mediated condition in the offspring.
Hello, and welcome back to the getwellbe podcast, a weekly series designed to help you learn, expand what you thought was possible, and become as empowered as you possibly can be in your health. I'm your host, Adrienne Nolan-Smith, a board-certified holistic patient advocate and the founder of getwellbe. And today I bring you a brand new episode with Dr. Michael Ruscio, a doctor, clinical researcher, and the best-selling author of a book called Happy Gut, Happy You, all about pediatric or children and infant gut health. Before we jump in, I want to give a shout out to Susan Noruzi. And Susan, I apologize if I mispronounce your last name, but you wrote a lovely little review of the podcast, actually about a different expert interview episode with Dr. Christian Gonzalez, a naturopathic oncologist that aired a few weeks ago. And Susan wrote, "This was absolutely my favorite episode. So if you haven't listened to it, do so right after this episode." And Susan, thank you for writing this review, and I'm so glad you liked the episode. If you're listening, email hello@getwellbe.com, and my team is going to send you a special gift in gratitude for leaving a review of the podcast. If you want a shout out from me or a chance to win a gift from getwellbe, make sure you leave a review wherever you listen to podcasts. You don't even have to stop listening to this episode. Just scroll all the way down on the getwellbe podcast page in your app and click Write a Review. Give us a few stars and a few words, and then press Submit in the top right-hand corner. It's super fast and easy, but actually very important for any podcast, so thank you for doing that now. It can be as short and sweet as Susan's, so thank you again for writing a review. Now, you may have heard me mention on some of the other recent episodes that I'm currently quite pregnant with my first child. There's even a chance, since I recorded this a few days before you're probably listening to it, that I've already had my son, but hopefully he's still cooking a bit longer and coming in early September. So as you can imagine, I'm thinking a lot about how to support my son's microbiome and gut health as he comes into the world and in his first days, weeks, and months of life. If you haven't already heard me say it, all roads lead to the gut. Your gut microbiome is the key to all good health and all disease. And the choices parents make, starting with how a man treats his body and therefore his sperm quality, through how a woman treats her body and therefore how her pregnancy goes, of course, choices made during delivery and in those first days, weeks, months, years, can play a major role in determining whether that child has chronic health issues or develops them later in life. So as you can imagine, I had a lot of questions for Dr. Ruscio on this topic, including things like, how is the child's microbiome different from an adult's? What is critical to do during childbirth and in those early days, weeks, and months to give a child optimal gut health and really support his microbiome? What is the deal with all the food allergies in children today? And lots more. So without further ado, here is Dr. Michael Ruscio. Michael, welcome.
Hi, thanks for having me.
Absolutely. So I can't wait to pick your brain about all of these important topics. A big focus at getwellbe is gut health, but I really haven't zeroed in on the gut microbiome in utero and also with, new babies and children and the differences in how you might approach, improving your gut or gut optimization as an adult versus as a child, and also things parents can do or people thinking of becoming pregnant or already pregnant to ensure good gut health before they even, have the child or before the child has any control over what they eat, et cetera. So thinking about the earliest stages, what can mothers do during pregnancy to ensure good gut health for babies? And I have to caveat by saying I'm asking this because I'm pregnant right now and doing a lot of reading on what I can do to create a baby with a strong gut microbiome.
Sure. Well, this is one of the sections in Healthy Gut, Healthy You is early life factors and how they influence gut health in children. And this does extend, to your point, all the way back to while the child's in utero and developing. And just as one example of what the research literature has found, they looked at different women who either had no contact with farm animals, had contact with, I think it was 1 to 2 or 2 to 4 or 4 to 6. And for every additional grouping of animals that mothers had contact with, they found a corresponding decrease in the level of inflammatory and immune-mediated condition in the offspring, which showed to the researchers that even while mom is pregnant, her exposure to dirt in the environment, and this is within reason, I wouldn't say a dumpster would be the kind of dirt that we're trying to contact. So we have to apply a little bit of logic to the statement, but what we might term old dirt, animals, forest environments, naturally occurring germs and bacteria and such, that seems to tune or attune the immune system of the mother and the child. So that gives us a bit of a hint in terms of what can mothers do to help improve their gut health and the gut health of the forming child. One thing would be contact with a natural environment. So not being kind of a germaphobe, again, within reason, right? If you go to a public bathroom, probably don't wash your hands. If you're hiking and you're getting in touch with dirt, or if you're in contact with animals, that's the type of exposure that's probably going to be more beneficial and tuning to the immune system. So that's one thing that we can do, is just have whatever reasonable degree of contact we can with a natural environment. There's also a dietary facets, which I'm sure you've probably discussed in the podcast. A whole foods diet, making sure that you're getting in sources of iodine would be important. Not so much for the microbiota per se, but for neurological development, which I'm sure you probably covered somewhere. And also omega-3, getting your fatty fish in is another important factor. Again, not so much relevant to gut health, but important just to mention. Another intervention that would be squarely toward gut health, probiotics. And this is where there's actually some really exciting literature. And I think it's something important for mothers to be aware of, because what sometimes happens, at least according to my observation in the conventional realm, when a conventional doctor, let's say a OB/GY, is not familiar with the body of literature, they'll just revert to, well, don't do anything. And you'll see, actually, my sister just had surgery and she was told, well, stop taking the probiotics. And I checked in with her 2 days later and I said, how you doing? And she said, I'm really, really constipated and gassy. I said, well, are you taking the probiotics? She said, no, my surgeon told me not to. All right, understandable. If they don't know, they're going to revert to nothing rather than potentially something that could be harmful. But there's great evidence that in certain models of surgery that taking probiotics can improve recovery rates, and definitely probiotics have been shown helpful with gas and constipation. So she starts taking them, and 2 days later, she said, I'm pooping normally again. So the same thing kind of happens with mothers, where they may be told, be careful with probiotics, but there's actually some very interesting evidence showing that children birthed from mothers who are taking probiotics while pregnant and or while breastfeeding have less eczema, as one example. So they're safe and effective for mother and for child. And they've even been shown, probiotics that is, to be safe and effective for kids in the neonatal intensive care unit. So even children who are really, you could say, sensitive and perhaps not thriving, this is where probiotics can be helpful. So, a few dietary notes, contact with your natural environment, and probiotics are a few places to start. And there's a lot in this conversation, but those are maybe a few of the main pillars that mothers can concern themselves with in trying to produce the healthiest kind of gut environment that they can for the health of their child.
Great. Okay. I'm like, check. I'm taking a probiotic. I'm trying to get good dirt. I think I'm doing a lot of the things. So that's great. So there have been studies that have identified that babies born vaginally as opposed to via C-section typically have a more diverse microbiome. However, we understand that methods of delivery isn't always in a mother's control, obviously. So what are some ways that parents can ensure that their baby's gut health is really being supported, for example, after a C-section birth, or if the child had an infection and had to be treated with antibiotics, really early on, like even a couple of days or weeks or something right after they're born?
If there's something like a C-section birth, then you may want to ask for a vaginal swab And some hospitals are doing this, some are not. But there's some evidence showing that just a swab of the vaginal fluid, because it contains a wealth of bacteria, can actually be just taken over the child. And that seems to prevent some of the loss of the bacteria inoculation you get when the child goes through the vaginal canal. So that's one option. And then probiotics, again, would be another in contact with the natural environment if the child has to use a antibiotic. And this is something I also write about in Healthy Gut Healthy You. Just trying to kind of give people, here's the framing of the argument and here's the risk. Because one of the things that I think we want to be careful to do more in the alternative medicine camp is not make these absolutists, like you can never give your child an antibiotic or it's going to ruin their gut for the rest. That sort of absolutist, fearful narrative, it shuts down thinking. And almost no choice is going to take you from 0 to 100 on the spectrum of risk. So it's important to understand that so that parents don't logically and kind of emotionally just revert away from using antibiotics, especially if it's a case where they may really be needed. Now, the other side of that coin is you want to make sure that you're not indiscriminately using antibiotics. And thankfully, this is something that in conventional medicine seems to be reformed, or at least it's strongly being reformed, just not giving kind of antibiotics out willy-nilly or prophylactically. So you want to be looking for your doctor seemingly being discerning in the use of antibiotics, and make sure that you're asking them, is it really essential that they're used here or now? Can we wait and see? If so, what's the risk? So just, make that calculation just to make sure you're not getting a doctor who's a little bit more flippant with the use. I think most now are not, but there's always some who maybe still are operating under a more antiquated paradigm. But if you do have to get antibiotics, again, it's not the end of the world. And I talk about, again, in Healthy Gut, Healthy You, there was this great analysis of, I believe it was a hunter-gatherer tribe in Papua New Guinea, and they were in access of conventional medical care and would be administered antibiotics on occasion when whatever sort of condition popped up, necessitating antibiotics. And they found that their microbiotas were still vastly healthier than most Westerners' microbiota. So even though they had antibiotics, they still looked much healthier than their Western cohorts. And it's likely because they had a much kind of healthier or dirt-rich environment. So that supports the position that antibiotics aren't the one thing that's going to irrevocably change the child's gut health. Now, the earlier the antibiotics are used, the more impactful they may be on the gut in a negative way. So we want to, again, be discerning, but there are other things that you can do, namely using a probiotic and trying to get contact with the natural environment as much as you can as kind of safeguard. So I hope I'm not giving you too much information there, but there's kind of a lot there to unpack. And if you have to use one, you can use one. Just make sure you're doing it in a justifiable way. And then natural environment contact and probiotics are two great ways to help prevent some of the damage, or I shouldn't say damage, some of the imbalances that antibiotics may cause in the gut.
I think you're optimistic about how many doctors are still, giving out antibiotics kind of loosely, I think, from just what I've seen and heard from some friends with kids. And the other thing that's interesting is a lot of people are accessing these city MDs and, more like these little clinics, because especially during COVID and these other things, it was just hard to get into an actual doctor, right? And so it's not your doctor, it's a doctor. And it's a very conveyor belt medicine style thing. So I think in those situations, it's probably easier to get, an antibiotic. And also there's a sense of covering yourself, I think it is changing too, but I think you see the better in people than me, maybe thinking that.
Well, yeah, I mean, all the more reason for the parents to be kind of engaged and just ask questions and don't underestimate your logical problem solving ability and just ask, how much risk does whatever you think going on poses? Is it something that typically resolves itself? And is the antibiotic being used to maybe reduce some of the child's suffering for a couple of days, but typically will they self-resolve as if it's a gut pathogen? Oftentimes gut pathogens are self-limiting. So these are just things that you want to ask and try to get a better understanding from the doctor. And the way the doctor answers your questions gives you a lot of information. If you get any of that kind of scoffing, then that's a pretty big red flag. If someone seems to be listening, now this is granted, you're asking the question in like a tactful way. So, that's the other side of the equation. But as long as you are, then even if you're not sure how to interpret their answer, it's how they answer your question that sometimes can be a red flag for if someone's taking you seriously and listening and caring about your concerns, or if they're not.
Definitely. Yeah. I'm a board certified patient advocate, and I'm not sure if you knew that, but that's a lot of what I advise people, is that you can read between the lines and just how a question is answered, but you have to start with respect in order to get it right. So if you start in antagonistic way, you're probably not going to get, something lovely back. But I agree with you. That's a great way to kind of tell how somebody thinks and kind of if they're going to be dogmatic. Yeah. And I love that you brought up that, the integrative holistic world can be dogmatic or absolutist as well, because that's my biggest pet peeve across all, the sides of medicine, conventional and otherwise, is the dogma. It doesn't have to be that way. You can measure risk, right? And so, like antibiotics, no antibiotics, and make a decision that way. It's not all, good, evil type of black, white thinking. So I'm glad that you brought that up. So you mentioned obviously probiotics. Can you take us a little bit deeper into different kinds of probiotics and how they work and when they're most effective and when they're not? And also, how do we determine the best probiotics for our own body? Because I think a lot of people just take a probiotic, and there are big differences in quality and obviously big differences in the type of bacteria that's in each one. And of course, the amount and type of bacteria that's in us as well. And it wasn't until I really, worked with a naturopath and looked more specifically at my own needs that I got a bit more targeted information on the type of probiotic I should be taking and the amount of, parts per billion or whatever that were in each one and how much you really need, et cetera. So if you could extrapolate on that, I think it would give people a lot more information about, okay, I want to take a probiotic. Now what?
Well, let me start by saying that my position on probiotics is probably different than what you may hear in most places. And this would include with naturopathic physicians. And I think it's important to acknowledge why and where that comes from. But one of the things I've observed with probiotics and in the field is, unfortunately, natural medicine and functional medicine is following conventional medicine just with a different peril. Instead of pharmaceutical companies, there are the nutraceutical companies who are really influencing education. And when that happens, and you trace that back a few steps further, what you see is that when a company makes a probiotic and then they fund a clinical trial, which is a wonderful thing in science that we need, unfortunately, what ends up spawning off of that is now the company declares, well, this is the best probiotic for XYZ because we have the clinical trial, and understandably so for that company, that's a piece of marketing clout, and they're proud of that and they want to educate about that. But what ends up happening is, there's this mistaken thinking that probiotic is the best probiotic for that condition. And these companies won't disclose, but oh, by the way, a different probiotic showed benefit for the same condition. They're not going to tell you that. So what ends up happening is this kind of market pressure to prop up one probiotic as the best for depression, another as the best for constipation, another as the best for kids. And when you look at the probiotic literature, you'll see this trend of, well, there was one probiotic that had a clinical trial for constipation, just as an example. But then 6 months later, a different probiotic also found benefit for constipation. And then a year after that, there was a clinical trial comparing two different probiotics, and they both found equal results for constipation. And the same thing for depression. And the same thing for children probiotics. You'll see that different formulas have been used in the various clinical trials. So instead of getting wrapped into this is the best formula for XYZ, or you need this specific strain or species for ABC, what I've come to see as a result of clinical reflection is that we can really break probiotics into three different types and then personalize those three different types to the individual. And the analogy that I use is a stool, as in a chair that you would sit on. So the stool requires legs in order to balance. Now, you can look at the stool as your gut microbiota. We want it balanced. We don't want it to fall over into imbalance. So one probiotic formula is akin to one leg of support. But if we can use 3 different formulas, now we have 3 legs of support encouraging and holding the gut microbiota in balance. The 3 different types of probiotics, 3 different categorical types, that pretty much all of the formulas on the market that have been used in the clinical trials organize themselves into, generally speaking, are your most traditional form, which is a combination of lactobacillus and bifidobacterium species blends. This is something akin to your VSL3. It's the oldest probiotic on the market, the oldest type. There's over 100 clinical trials using this type of probiotic. The second type is actually a healthy fungus, and this is Saccharomyces boulardii. And there's about 50 or so clinical trials with this type of probiotic. And again, it's a healthy fungus, and it's been shown to help in a multitude of different conditions. And then third and finally, there's this newer probiotic, kind of the golden child of the paleo and ancestral health community. These are your soil-based probiotics. This is something, Prescriptive Cyst was a formula. There's Megaspore, there's soil-based probiotic. So that's the third type. And there's about 20 to 40 studies on that, depending on what body of literature you look at, finding benefit in various conditions also. Why this is important and why this is relevant is because the consumer is confronted with this is the best probiotic for that. And there's all these competing marketing claims on the internet. But what underlies that is a selective citation of the science. Right? We're going to tell you that our probiotic is best because of the references for our probiotic. We're going to not tell you about the competitor probiotic that showed something similar, or the other competitor, leading you with this dizzying array of options and no unifying philosophy for what seems to be the best way to use probiotics is having the highest species count that you can. The more species tends to be the more beneficial effect. And this has been shown in a few of the review papers for IBS as one model, meaning when researchers look at 1 species or 2 species as compared to 10 to 15 species, there's a trend where the more species equals the better result. And so that's essentially what I'm continuing with the 3 category system, so that an individual can try one category, see how they feel. If there's partial improvement and they need more resolution, they can go on the second and even go on the third to try to have the most kind of all-encompassing 3-legged support for the microbiota. And that's what I found to work vastly better than one probiotic alone. And it also gets you through kind of the maze of all these claims that people are getting peppered with.
Wow, that was very helpful and very in-depth. And, from some previous interviews and just my own research and knowledge, your advice about probiotics mirrors advice about your diet to strengthen your gut as well, right? Like a more diverse diet with tons of different kinds of plants and fiber is going to yield a very strong gut, and a stronger gut than if you didn't. And you want to have as many different kinds of good bacteria as you can. So it really makes sense, right, that you would want to have a probiotic that has a lot of different species versus just high amounts of one, because otherwise the dietary things that we've heard wouldn't make sense, and all of that. So on the dietary side, and just thinking about children, I guess this applies to adults as well, but picky eating is a challenge among children. There's a reason there's a kids menu, and everything has to be kind of bland, and when they can choose at least chicken nuggets and white, all sort of white foods and things like that, French fries. Can a diverse diet offer the right amount of gut health support for kids? Or do you recommend, just because children tend to be more picky eaters, that all children are taking a probiotic? Or is it really just if you've had, the mother had to, or the child had to take antibiotics or something like that, where was a C-section baby, that you recommend starting on an actual probiotic supplement when kids are young? I
don't think it's a bad idea to have any child on a probiotic, just looking at the benefit that's been shown in the trials and no real detriment. I don't think probiotics are a bad thing to at least have as something you're using in kind of a loose on-off application. You don't have to be anal about it and take them on vacation with you and chase down your kid if they missed a dose one morning. But as a general kind of replacement for the fact that we don't get enough exposure to bacteria to begin with, I think it's a good hedge to have in place that is really low to no risk. And some benefit. So it seems worthwhile. in terms of how could disruptions in the gut microbiota map on to picky eating, I don't know. That's not something I've actually looked into directly. I'm not sure if there's been any research done there yet, but I wouldn't be surprised to find that poor or suboptimal gut health could in part underlie picky eating. Some of this could be genetic. Sure, I don't want to just make it all about gut health per se, but seeing in adults that when people have disrupted gut health, they become more selective in what they eat because they're more food reactive. It would hold that same thing could be happening in children, but they just don't have the ability to describe what's going on, meaning I think I'm lactose intolerant or I feel tired after I eat this. They don't have that ability to really express that. So I wonder if in part the picky eating is a learned behavior secondary to the fact that certain foods aren't sitting well with them. Like people with IBS oftentimes avoid higher FODMAP foods because they notice a negative gut reaction. So I wouldn't be surprised if there was a degree of that found. And then in tandem with that, a fair part of this is likely just desensitization of the taste buds, which seems to be something that happens pretty quickly with children. If they're given unhealthy food, many of those foods are made to be so addictive that they can kind of skew in a certain unhealthy palate. So I'm assuming most of your audience is probably attuned to that. But yeah, I mean, those are a few things that you can consider with picky eating. And then to the other part of your question, it's a partial misnomer that we have to eat a really broad, vast array of fibers and fruits and vegetables to have a healthy gut. It is true that diversity in the gut correlates with health, but it's a mistake to think that it's a one-way street, meaning you feed your gut bacteria, they become more diverse, you become healthier. And this is evidenced by the fairly compelling body of literature that's found that those with irritable bowel syndrome, IBS, and inflammatory bowel disease, they actually get worse in many cases, not all cases, but there's a strong trend that those cohorts get worse with too high of a fiber intake. And this is one mistake that has really come out of the interest in the microbiota. It's this mistaking kind of reductionistic thinking that it's this simple, straight pathway. Feed your gut bacteria, they're more diverse, you're more healthy. And in some cases, you do that and there's more inflammation and there's a flaring of disease activity. And this is likely because it's not as simple as just kind of force feeding the microbiota. Think of it kind of like a garden. It's almost like saying, well, the more you water a garden, the healthier it's going to be. There's a point at which too much water becomes a problem. And that may be different for every garden, right? A garden with lots of sun exposure may need more water. A garden in a slightly cooler climate with lots of shade will likely thrive on less water. And this is kind of the bioindividuality piece that's been left out of much of the microbiota narrative. And it's been kind of whittled down to this really reductionistic thinking of, feed your gut bacteria and then they're going to bloom and you're going to be healthier. And that's the opposite of how it goes for some people. Diet quality is really important, the quality of your food, but it's not indiscriminately tied to the fiber content of your diet.
Very interesting. We had an interview with a doctor who was all about, the more fiber you could get. So it's great to hear a different perspective on how, bioindividuality plays a role in that case and how it could just be too much maybe for an imbalanced gut to handle, throwing like a lot of different bacteria at it, at once. So
I appreciate that doctor's perspective, and that perspective is not necessarily wrong. It's the most correct when you're going from the standard American diet, which is high in sugar and high in processed foods and low in fiber principally. But when you go into the realm of healthier diets and you kind of have this range of, let's say you're going to do a low carb paleo, probably the lower fiber end of the spectrum, and a Mediterranean or vegetarian diet on the higher end of the spectrum, those have all been shown to be health promoting. And it's a real sad misnomer when we position any facet of diet as just push it as far as you can in one direction and there's no sweet spot. That happens with carbs, it happens with fats, it happens with fiber. And I would really, with all due respect to the other guest, and I'm not sure how he or she was contextualizing this, but I'd really caution the audience with those sorts of arguments because those are typically a byproduct of someone who's too enthusiastic about a hypothesis, because there's almost always contradictory data. And what ends up happening when we focus on all the data that says what we want and ignore that what we don't, the people who needed this advice are harmed by that. Because now, and this is what I see a lot of in the clinic, people come in just getting bloated and having constipation or having diarrhea and having the resultant fatigue as a byproduct of that. And we'll have them go, let's say, on the low FODMAP diet, which reduces prebiotics and fiber. And in a month, they come back feeling dramatically better. And they go, I just read so much about fiber. It's like, well, that's not necessarily untrue, but it's not true for you. And with all the inflammation that was going on in your gut, that fiber is actually feeding the bacteria that the immune system was acting against. And so you're actually kind of provoking a system that was turbulent. So anyways, sorry for the kind of diatribe, but it's really important because it's those people are disturbed by that kind of unilateral messaging.
I actually totally agree with you. I liked his message because it made me, and I think a lot of audience members, think about how many different plants they were eating in a day, right? You just kind of get on autopilot with what you buy at the store and what you might put in a salad. And so it helped me to take a salad with 5 ingredients that I had a couple times a week and make it 15 ingredients, because I just started throwing more in and, so that was great. But I agree with you that, it didn't leave a lot of explanation for, or caveats for when someone their gut just really can show them they're not doing well with beans or with grains or with these other, things where it's more nuanced. And then you really have to understand what's going on in their gut. And it's not just an across the board thing. So I really do agree and appreciate that. So you mentioned some of the things that harm our gut: lack of access to nature and good dirt, certainly a lack of a diverse diet. What are some of the biggest threats to children's microbiome specifically today? And what can we do to kind of mitigate some of these threats for those that can't be avoided? How best to deal with that? I know obviously taking a probiotic is helpful, but there's just a lot of different things that impact the gut. So I'm thinking about all the different threats out there and what are the biggest?
Sure. Well, yeah, I don't look at children really much differently than I look at adults. So, all the same things that adults do are important. Sleep. It's been shown that disruptions of sleep rhythm actually have a negative impact on the microbiota. It's been shown that exercise actually improves the health of the microbiota. So there's this bidirectional piece where the diet influences the microbiota, but so doesn't the health of the host. That's kind of the point I was driving at earlier, that it's not just a one-way street between, the microbiota impacts the host. There's also the host health impacts the microbiota. And so this is where it's exciting to see things like in studies where those who were sedentary started exercising and their microbiota was mapped all along the way. The health of the microbiota, the diversity actually improves when one starts getting exercise. Or when there's a disruption of the sleep rhythm, that also causes problems with the microbiota. Time in nature has been shown to be healthy, not only due to the bacteria that are vectored, but there's also this body of research that has shown that people who live near oceanic or forest environments or spend more time in those, they actually have a lower all-cause mortality, meaning a lower chance of death from any cause. So there's something therapeutic about nature, including but not limited to the microbiota. There's also some evidence showing that exposure to the sun and or vitamin D levels have a positive impact on the microbiota. It's earlier data there, but it makes a lot of sense when we understand the vitamin D immune system connection, and that part of what allows your microbiota to be healthy is if your immune system is properly tuned. Immune systems that are too overzealous, they tend to not get along with the resident microbiota, the resident bacteria. So you have the bacteria and the immune system that houses them. And in some cases, the immune system is attacking. This is a hallmark of inflammatory bowel disease, where there's actual autoimmune attack against the resident bacteria because the immune system has just kind of lost its aim and it's starting to kind of shoot at everything, so to speak. So that's where the vitamin D and sun exposure connection sort of ties in. And, the health of the diet. And I appreciate that point of your other guests of trying to encourage people to eat the broadest diet that they can. And that is the aim that we want to get to. Just, I guess, honoring that broadness may vary from person to person. But for children, yes, that broad diet and making sure things are nutrient rich and not processed is a big step. And yeah, I mean, those are really some of the main hallmarks, in addition to trying to use antibiotics as discerningly as possible. And you're well on your way towards a healthy gut health by implementing that kind of holistic approach.
Great. Okay. So you talked about when the immune system is kind of overzealous and attacking things, and it makes me think about food allergies and food sensitivities. They're just obviously becoming so much more common for children today. It seems like a new one that's very serious pops up every day. When I was growing up, it just seemed like you were told about nut allergies and that was it. Now there's just so many. It's very clear that something is wrong in our environment rather than there's something wrong with all of these different kinds of foods. So what are some of the most effective ways you can test for and identify, the real root causes of different food allergies and sensitivities in children, considering that specialty and elimination diets are already hard to follow for adults, and then for children, seemingly, even more challenging?
Right. Well, it depends on what type of allergy you're trying to test for. If it's the anaphylactic kind of emergency reaction, the IgE mediated, then that's probably just going to your allergist and having the kind of older school blood testing and or skin patch testing should be sufficient. That's probably not what most people need help identifying, because those tend to be fairly obvious in how they manifest. For the other types of tests that, maybe my child doesn't do well with dairy, maybe they don't do well with grains. This is where perhaps you could food allergy test, but I ran food allergy testing in the clinic for a couple of years, and it just does not seem to be highly effective. There is some data that has shown benefit in a kind of clinical setting that food allergy testing can help someone more quickly identify what they're allergic to. So there is some evidence, but what ends up being found is the foods that are most typically avoided are the ones that the testing is showing pose a problem, like dairy, gluten, soy, what have you. The other part of this that's complicating is food allergy testing only gives you maybe 1/3 of the type of food reactivity someone may have. Someone may be intolerant to FODMAP content, meaning they may not do well with high FODMAP foods, which is a really important aspect of the gut diet modification for a fair subset of people. In fact, the British Dietetic Association, in their guidelines for IBS management, recommends first starting with a general kind of food quality and junk food elimination diet. And if that doesn't resolve the symptoms, they don't recommend food allergy testing. They recommend trialing of a low FODMAP diet. And it's because a FODMAP intolerance won't show up on a food allergy test, nor will if someone's sensitive to fiber. If some people eat too much fiber, they may flare their digestion. This is one of the most common things I think any clinician working in gut health will see, is that fiber can kind of cut both ways, and too much can be problematic. There's also dietary histamines that for children especially seem to cause tantrums and mood problems if they consume too much histamine. That won't show up on a food allergy test. So I think the food allergy tests give parents a false sense of security regarding what they should be eating. The other thing that also complicates this is the more compromised your child's gut health is, the more likely you're going to see what's known as a false positive on the food allergy test. So when I had a gut that was a mess in college, I had 23 foods I was allergic to. I wasn't really allergic to any of those foods, but I did have a major inflammatory problem in my gut causing me to develop what's known as acquired intolerances. Essentially, my gut was chronically leaky. So my immune system started reacting to many foods because my gut was just like a sieve letting things through that it shouldn't. And so all those food reactions on the ALCAT test I had 15 or so years ago, none of those foods are foods I have a problem with today. but I had to go through the exercise of improving my gut health so as not to have those reactions. So yeah, I think if used responsibly, perhaps they offer some utility. But with the fact that food allergy tests are anywhere from $500 to $1,000 in a lot of cases, and they miss a few of these things that will thwart you from getting to where you want to be, I just, me nor any of the doctors at our center really have gotten behind the use of food allergy testing.
Yeah, the more I have asked people about testing for things related to food, the more I believe that it's very incomplete, inaccurate to get an actual test for a lot of food things. And so it is a bit of elimination and experimentation to understand what that is. And some people might feel like because they prepare their food for their children, it's easier to control, but others would say, I can't get my kid to eat, things that are on this elimination diet or whatever. So that would make it harder. But I agree that going to an allergist and then getting a test and being like, oh, well, that solves it, is really not going to cut it, I think.
One or two other things I should slip in is when performing dietary restrictions with children, we should really be as light-handed as possible. There is some evidence showing that overly adherent dietary practicing in children leads them to have more issues with food and their relationship with food, like orthorexia or binge eating when they get older. So in the clinic, I'm very light-handed with the recommendations, and I also try to never frame things in a pathological way for children. So, you can't eat this, Tommy, because it's going to inflame you and it's going to make you sick. I try to really frame it as, this may help you feel the best, and this may be what your body runs the best on, and just avoid any language that has a negative valence, because we don't want kids starting to internalize psychologically like there's something wrong with me. So I think that's a really important A, and B would be, I try to lean more heavily with children on supplements. Now, I try to really be a diet first sort of provider, but with kids, it's harder to get compliance, and it's easier for them to start to fight you. And it's also easy for them to start to build up these neurotic relationships with food. So I'll try to get more out of something like probiotics so that hopefully they have more tolerance and they start seeing some of the symptomatic improvement. And as one aside, there's been many trials that have found that in children, lactose intolerance demonstrably improves after using probiotics. Just as one example, it's not all about probiotics, it's just a good starting point. So those are things I'll try to push on more so that we don't have to really fetter the children with either the psychological burden or just the logistical burden of having to be, any more food avoidant than we absolutely have to have them be.
Oh, interesting. I really hadn't thought about that. And I know quite a few adults now who had food allergies and things like that. And they do seem to have a fearful relationship with those food categories or just with meals in general, or how am I going to navigate this gathering and not being able to eat this or that, or is it going to be awkward that I have to say this or bring that? So the fact that you're thinking about that is great because, it means you're really caring for the whole person, not just their gut, but their psychological well-being as well, which also has an impact on the gut. So it's all very connected. Also on the topic of testing though, what are your thoughts on testing as far as stool testing and GI mapping for children? Do you think it's necessary, or do you believe that similar strategies or just understanding symptoms and then making assumptions based on that can be utilized in order to rebalance the gut of a child who, has an imbalanced gut without expensive or fancy testing?
Yeah. I mean, with kids, again, I think we need to be really careful about not having them do any stuff that's not essential, because we don't want to lead them into that paradigm of thinking that they're ill or they have to avoid foods, because there is such a thing as nocebo. So nocebo is the manifestation of a negative outcome, where placebo is a manifestation of a positive outcome. They're the other side of the coin. So yes, testing in some cases, but it's much, much more rare. Here's an example. You could do a SIBO breath test and a GI map stool test, of which I like, the SIBO breath tests are generally accurate. The GI map is a good stool test, but you can resolve SIBO with probiotics. There have been 24 plus clinical trials now that have found that probiotics as a standalone therapy can remedy SIBO. So do you need to test for SIBO if the probiotics can resolve it? And could you just monitor someone's symptoms and see if their symptoms are improving? That likely tells you that the labs would improve. Seems reasonable. And most of the findings in a GI map can also be rectified by probiotics. Probiotics has been shown to be anti-Giardia. There have been studies looking at probiotics head-to-head against antifungal medications and finding equivalent results. Probiotics are anti-H. pylori. There's the exception of if a kid presents with what seems like a parasitic infection, which is, acute and frank symptomatology, perhaps. But the idea of starting with some gentle dietary changes, right? Kind of general food quality. And sure, if there's going to be ice cream and pizza tonight, have the indulgence. Like, let the kid live like we'd want a healthy adult to live. My aim is for no adults to reclude into this living like a nun, but it's being healthy baseline and then being able to have those, excursions where you go out and you have a dessert and so we'd want that same thing for a child, but try to get the rest of the diet as healthy as we can. And then layer in something like probiotics. And there's a few other things that you may want to trial, enzymes, immunoglobulins, and see how far you can get their gut health just by feeling around with the natural and safe interventions that we have. The thinking that we have to do testing up the wazoo for every person to then use oregano oil, probiotics, enzymes, and immunoglobulins, it's silly. And it hurts people. It subjects them to way too much cost. And then they go and they look up every bacteria that they find on the GI map, many of which are dysbiotic, meaning they may be a problem, they may not be a problem, but they'll find the worst interpretation of a paper on the internet and, put that in the back of their head, and all these things start building up, and there goes the psyche. So no, for children, use of testing is really selective. And just a reminder that so much of what we do in natural medicine is safe and doesn't need to be guided by a lab. I appreciate kind of that impetus to be scientific and to document pre-post, but too many providers are functioning more like researchers than they are clinicians. And this is something I think conventional medicine does pretty well. They will oftentimes not do a test if it's expensive or if it's invasive, and they'll just do an empiric trial of the treatment. I think this is the evolution of where natural medicine is going to go next. There's been enough scientific documentation of a lot of what we do, and now the serial testing and retesting is something that can be left more so for a research setting or for selective cases that have kind of failed out of all of these great natural interventions that we can navigate with an individual.
I agree with that. It's a rabbit hole if you start to go down all the different functional medicine tests that you can take and things like that. And often when I have done them, it very rarely ends in some sort of clear action. It ends up being a little bit more nice to know than it is a roadmap to then plan out the next treatment or the next action in your healing protocol. So I think that's very interesting. One part of that I had a question about, and this was a different question I wanted to ask you. If a child is on like a gut healing protocol, right? Like, it's very clear they have a lot of different symptoms and you're trying to heal their gut. They obviously have to be stricter or more restrictive than if they were, already went through it. Their gut was healed. They could obviously have some ice cream and cake here and there, but it's not going to destroy everything, versus if they're, in week 2 of a 3-week, gut healing protocol. Do you think like that? Do you think a child can do that, a gut healing protocol, and really have to be restrictive in that phase? Or do you still feel like you should
It's a great question. I'm glad that you're posing it. But what ends up happening when we create such rigid strictures for individuals is long-term compliance goes down. And I also haven't found that 1 or 2 deviations, let's say you're doing antimicrobial, herbs. I haven't found that an occasional deviation from the diet is going to be the difference between success and failure. Now, this is under the one caveat that you don't notice any fairly marked food reactivity. Like, some people are really sensitive to gluten, and it's like, okay, you have gluten and you feel it for 3 to 4 days. Okay, so, we've given you the freedom to learn on your own. And now, based upon that biofeedback, it's fairly obvious what you should do. That's the healthy way. The unhealthy way is, oh, you can never have any gluten because it'll upregulate inflammatory cascades in your intestines for 6 months. And now people are just avoiding gluten on faith. And they've never actually tried to see, well, what should my relationship with this food be, or with dairy be, or what have you, so that I know what my level of reactivity is and I can eat in a correspondent fashion. I think it's a mistake that we have to be so ardently strict during these cleanses or whatever it is. And I just don't see it happen in the clinic. And this is one of the many things that we're challenging in the clinic is how steadfast do we have to be with some of these, recommendations. And much of this is a lot easier than you would think. No, I give people some leeway. Now some people are really type A and they enjoy kind of like just being really organized. But some people, it kind of crushes them and they feel like, oh gosh, like I'm a really social person and I love food. And sure, I have some bloating and I have some loose stools and abdominal pain, but I also really love a glass of wine and ice cream. And could they do that once per week on a probiotic intervention? Yeah. And would that be the make or break? No. Would it be the make or break while on antimicrobial therapy? No. Would it be the make or break on an elemental diet? Probably not. So I think we can make natural medicine a lot easier for people. And I think we're holding people to this standard that it just doesn't need to be held. And the patients who come in with their Excel table for their dosing, it's like, where is this coming from? You have 15 different doses throughout the day. And, these things add up and they start to really harm people. The $2,000 worth of testing, half of which may be complete bunk. The 7 diagnoses that you have because of that, half of which are bunk, that are weighing you down. The strict diet, the Excel table of supplements, like this is really harming people. And there's a lot of good here, right? But if we just get rid of some of the excess, maybe one discerningly used test, a relaxed iteration of the diet, a dosing regime that's twice per day, now you'll get to a similar outcome, but the experience and the cost for the patient will be vastly different.
Well, it's very encouraging to hear that you are seeing good gut healing results and symptom resolution results in your clinic, even when somebody, does have a night of wine and ice cream a week or something like that, because it was my perception that you couldn't really do that in the beginning if you wanted to have a successfully healed gut. What are the other things you've seen that have been really successful in your clinic for people with gut symptoms or just symptoms they don't know are related to the gut?
Well, thank you. And I should also mention, because sometimes when I make that remark, I'll hear later about a provider, maybe like in the chat section, who goes, well, I see chronically ill patients. Well, we do too. We see really, in some cases, chronically ill patients. And usually we've seen someone who's bounced from gastro to ND to acupuncturist to integrative nutritionist to ND to gastro again. And then they come and they see us. And in some cases, this is not all, but it's enough where you can clearly see it. Just having some relaxation in how their care is being vectored leads to a huge improvement in how they're feeling, because they're just under this huge weight of restriction and fear and worry. And when you can just lift that for them, a lot of healing just opens up. So, I don't mean to be critical of the field just for no reason, but these are real people who are suffering for years and years sometimes. And so, I think we need to be more mindful of the weight that what we say and how we say it, the weight that carries. But then to your question, immunoglobulin therapy is something that's very interesting, as is elemental dieting. Immunoglobulins are essentially a supplemental way of taking the immune membrane or the mucous membrane that lines your gut. And these capsules or powders, they make their way through your intestinal tract. And what they do is they bind to LPS fragments or fragments of bacteria or certain toxins. And you can think of this as if a bacterial fragment is like a shard of glass, it could kind of irritate the lining of your gut and cause this inflammatory reaction. And immunoglobulin is like taking that shard of glass and wrapping it with wax and making it unable to kind of cut or irritate. So kind of like deactivates them from an immune perspective. So immunoglobulins are one that have been interesting. And also elemental dieting, which is a liquid meal replacement that's hypoallergenic and starves bacteria and probably also starves fungal overgrowths and reduces antigens or foods that your body is reacting negatively to. in this kind of pre-digested liquid hypoallergenic formula. Those two have been helpful for people who haven't really done well with more of the frontline therapies, the various diets, probiotics, and then maybe some type of antimicrobial therapy, whether it be berberine, alicillin, oregano, what have you. For people who haven't seen optimum results with those, elemental and immunoglobulin therapy can be quite helpful in those cases.
Okay, so it sounds like some diet change is necessary, but not completely restrictive, plus this sort of herbal supplementation and enzyme supplementation and things like that. You seem to be most effective.
Yeah, diet at the core, and typically we'll start with kind of standard elimination, something like a paleo framework that gets rid of or reduces, generally speaking, in a non-fanatical fashion, common inflammatory foods. And if that doesn't work, we'll try a low FODMAP application. And then from there, we'll go to, we call it probiotic triple therapy. That's the 3 different probiotics used in synergy. And then from there, we'll kind of reevaluate, see how they're doing. And oftentimes we'll next go to either elemental dieting in a short stint as a couple of day liquid diet reset, or to antimicrobial therapy, and kind of end the line with immunoglobulins. And that's a typical hierarchy that we kind of work through. And that hierarchical kind of step-by-step thinking is really helpful, because what I see in probably the majority of patients, especially the ones that have kind of bounced from doctor to doctor, is they're looking for the one thing, and they don't have kind of like a long game perspective. Well, if we can pick up 20% from diet, 30% from probiotics, 20% from antimicrobials, and then round the corner with another 20% with a finishing touch of an elemental reset, then that's your personalized plan. But why I was eluding you is because you were trying these things haphazardly without this kind of, let's weave together a personalized plan for you that seems to work, and do it in kind of a methodical, stepwise fashion.
Yeah, I do always recommend, when people haven't been taking probiotics before or are trying to use them therapeutically for a symptom, like give it a real shot, meaning don't miss for 2 weeks or, something like that, to see if it has an impact. Of course, nothing seems like it's going to work if it's done kind of so sporadically and without any tracking or awareness, because it's too hard to know. It's right. Especially with natural interventions, they're not going to be as powerful or as noticeable as a antibiotic, for example, on, stopping a symptom. And so how they can be successful is that if you do them consistently, they'll actually work in the long run. But I have seen that a lot of people say, oh, I tried acupuncture for that thing. It didn't work. I said, well, how did you try it? Well, I went to this place and I'm not even sure if they were licensed or whatever, but I did like 2 sessions in 2 weeks, and then I got really busy with work. And like 3 months later, I went back. But anyway, right. It just didn't work for me. And you're like, well, that's about as loose of a treatment plan I've ever seen.
Mm-hmm. Yeah, well said.
So, that applies to all different kinds of natural interventions. So I agree with you very much that it's like not worth trying unless you have a little bit of a structured plan around it with which to measure, did some improvement happen, All right. Well, we're coming up on time, and I really appreciate so much of what you shared today. Just a wealth of knowledge in this area, and some very different perspectives, which I really appreciate, because I am very anti-dogma, both in conventional healthcare and in the natural medicine world. And I hate absolutes. And I know there's 5 sides to every story. And it's really great to hear different perspectives within the natural medicine world and just in general. So I appreciate those. One final question, since this interview was really, focused on pediatric gut health versus just, great gut health in general, but there's so much overlap. Does the gut really change from, being a child to being an adult, or is it really just, once you are eating foods that are not breast milk, you have a gut microbiome and good bacteria and bad bacteria and everything else is coming in, and then it just grows as you grow, or does it have to be treated differently?
So there's one key difference in that the gut microbiota and the impact it has on the immune system is predominantly formed by the 3rd to the 4th year of life. So there is this really important kind of pivotal formative window that we should be concerned with. But beyond that, the way we tend the garden that is the gut, it's really quite similar for adults and children. So no, there's not a demonstrable change, but there is this maturation. And, the younger you are, the more important these things are because it sets the stage for formation. But it's really important for me to say that even if you were a kid who, say, wasn't breastfed and was C-section birthed, it doesn't mean that you're cast into this category of gut health that cannot be remedied. I'll tell the people we work with at the clinic, we can do a whole heck of a lot with what we have right now. So don't worry about what happened in the past. We can't do anything about that. And, there's all these great therapeutics that we have that can support your gut and give you that little push here or there that you need to get back to balance.
I'm so glad you said that because we brought up C-sections and,
Right.
Not being breastfed and stuff in the beginning. And I would have hated for someone to listen thinking, oh God, now I'm really screwed. But yes, it is rectifiable. You just have to do extra work, right? It's like anything. If you have some sort of injury or you start out a couple steps behind others, catching up, you have to just do a little bit more maybe.
And it's not impactful for everyone. That's the other thing that's important. It's not to say that there's this 100% correlation between those who are cesarean sectioned and IBS. It's just there's a couple percentage points more of an increased risk for that, but it's not like a 70% jump. And that's the other thing that I think is really important. The field tried to do a better job with is assigning a level of risk to an association. Because oftentimes people hear, there's more inflammatory disorders with C-sections. It's like, yes, but it's a pretty small increase. It is an increase and it's not chance. So the stats show that it's a legit finding, but it's not like in many cases, it's not a big over 50% chance. Oftentimes, the probability is something in the single digits. So that's really important to mention.
That is really important to mention. I'm glad you said that. Do you offhand know the probability of, symptoms or conditions related to the gut later in life for breastfeeding as well? Is like one a bigger risk than the other?
I don't. It's been a couple of years since I've really gone through that literature in an intense fashion. And at that time, as an admonition of how I think we're all learning and evolving, I didn't fully appreciate what's known as effect size a few years back. And I'm really over the past couple of years coming to understand that effect size, meaning the magnitude of the risk or the association, is really important for us to disclose. One I'll share, a little bit unrelated, but it may be interesting to your audience, is that when people have Hashimoto's or the thyroid antibodies, the best study that looked at this only found a 9 to 19% association to actually becoming hypothyroid. And that was really enlightening for me because oftentimes people who are diagnosed with Hashimoto's, this autoimmune condition of the thyroid, they think it's a guarantee that they're going to become full-blown hypothyroid. But there's actually only less than a 20% chance that will happen. And so, I include myself in that criticism of the effect size. And so now I'm trying to really bring that forward into all the messaging. I apologize. I don't have that offhand for the C-section or the breastfeed.
That's fine. I just thought it would be interesting, given that you knew the C-section was in the single digits, if breastfeeding was as well, and kind of could somebody who had a C-section delivery breastfeed for longer as a way to try to catch up to mitigate some of the increased risk that having that C-section then had. My gut reaction is that breastfeeding for a certain amount of time or as long as possible is probably more impactful just because you're getting so much, of the woman's antibodies and the gut flora and everything else that she has. But who knows? I absolutely don't. So we'll have to find that statistic for everybody listening at some point. All right. Well, Michael, thank you so much for sharing all of this. Where can people find you? I know I mentioned drruscio.com is your website in the beginning. I know that you've also written a book on gut health, I believe.
Yeah. drruscio.com is my website. It's DRRUSCIO. And the book is Healthy Gut, Healthy You. We have a podcast. I also have a clinical practice with myself, a number of other doctors and a research staff. And we're also doing research and publishing what we find in peer-reviewed medical journals because we're really trying to lead the charge, to whatever extent we can in rectifying some of these wrongs. And that's all available through kind of like the main hub of drruscio.com.
Great. Well, thanks for taking the time and have a wonderful day.
Yeah, thank you. I appreciate it.
Now, I'd love to know whether you're trying to conceive, you are pregnant, or you have children, or none of the above. Since Dr. Ruscio mentioned a few times that what he believes is best for a child's microbiome is also best for an adult's, what's a concrete action you can take right now based on what he talked about today? If you're looking for a practitioner-grade probiotic, for example, or any other vetted and high-quality supplements, you can check out the natural medicine section in the WellBe non-toxic product database at getwellbe.com. Or perhaps you want to clean out your fridge right now and get rid of things known to disrupt the gut. Whatever it is, make sure you leave a comment on the article version of this episode on getwellbe.com, and you'll find a link to it in the show notes. It's helpful for the entire WellBe community to know your takeaways, your actions, and your insights. Also, while you're there, definitely grab our gut health guide. It's the most comprehensive, free piece of content we have on the site. And you'll also become a WellBe insider so that you can get all of our latest content, special offers, and personal notes I don't share anywhere else weekly in your inbox. It's the best way to know how you're doing as far as supporting your gut, and includes actionable steps you can take to improve and optimize your gut at home, some of which are totally free. All right, I'll see you back here next week for another episode of the WellBe podcast. And if you can believe it, next week is going to be our last episode of season 6, given the little guy coming into the world any day now. Don't forget, we have over 130 episodes published, so definitely scroll through and check out other episodes that appeal to you. Oh, and if you haven't already, subscribe to the podcast so that as soon as I'm back with season 7, you'll get the episode delivered to you as soon as I publish it. And I may share a few short personal update episodes during my first few weeks and months with the little guy, since I'm sure it's going to be a wild ride that I'll want to tell you all about. If you're subscribed, you'll be notified if and when I publish any of those. As always, please share this episode with family or friends who you think might find it valuable and informative. It means a lot and helps more people find the podcast. If you already have done that, then thank you so much. I really appreciate it. Once again, this is your host, Adrienne Nolan-Smith, and thanks for listening to the WellBe podcast.